Hi everyone, welcome back to iMumz Ask Me Anything session. So today we have a very senior doctor from Lucknow, and she's going to speak about all about your third trimester. So you just brace yourself. I'll quickly introduce ma'am. She is actually the unit head and in charge of the Genital Cancer Control Unit in King George Medical College in Lucknow. And ma'am has published so many papers, done so many deliveries, taken care of so many women. So we are very happy to have you with us, ma'am. Thank you for making time during these difficult times. Over to you, ma'am.
Thank you so much, Anusuya. And it's my pleasure to be here on this Moms app program. And so, as the topic that you have chosen for me, uh, what women should know all about the third trimester of pregnancy. I would just like to speak about that a little bit and then later take up the questions and all. So, when we say third trimester of pregnancy, the pregnancy is a 9 months gestation normally. And so we divide it into three trimesters: the first 3 months, the next 3 months, that is from fourth to 6 months, and then seventh, eighth, and ninth month. So that is the last trimester, and that is known as the third trimester of pregnancy from 7 month onwards. So now this is an important time because this is a time that the baby is actually growing, it's live, it's kicking, and there is a gradual increase in the size of the uterus, because of which the baby bump is more clearly visible. And of course it leads to a little bit of discomfort also because of the increase in the size, and discomfort in the routine daily activities also. But of course this is the most pleasurable time also of the pregnancy. So in the third trimester, what you mostly have started feeling the fetal movements, so you can appreciate that, and you can move around, you can do your activities, but with a little discomfort or little limitation that will be there. Now, in the third trimester, what happens to the baby? The baby is growing, all the organs have been formed, the placenta is increasing in size, and the baby has, started all its functions. All the organs are well made, and the functions are just like an adult, that all the systems are working: the cardiovascular system, the respiratory system, and even the swallowing is there, and everything is there. You can see that. Now, in this, when do you visit the doctor? Usually, traditionally, we used to call women every 2 weeks. Nowadays, but they say that even if minimum visits, if you have to do, then at least 28 weeks, that is around 7 months itself, and then one at 32 weeks and one at 36 weeks should be done. So that's the minimum, but of course you should take advice of your doctor who calls whenever they call you. And especially in these COVID times, it is better that you take a consultation, a teleconsultation. Many of the things can be discussed on the video call only, and even the investigations can be shared. So only when there is an important need to go and visit, you should visit the doctor in these COVID times. Otherwise, as I said, usually we call the women every 2 to 3 weeks during the third trimester. Some of the common problems that are there, which develop during this time, two things which are two diseases even in the non-pregnant nowadays very common, are hypertension and diabetes. So during pregnancy also there is something known as the gestational hypertension, that is increase in the blood pressure during pregnancy, and there is gestational diabetes mellitus. So these two things will develop usually in this trimester. Then women can have the problems like of leaking is because of the rupture of the water bag that is there around the baby, and sometimes bleeding could also be there. So these are some important things which, if they happen, you must visit the doctor and get yourself examined and follow the advice. If there is a need for admission, you will have to. So whenever you go to the doctor during this time, you should go prepared that with these problems there might be an indication for admission. and the doctor may tell you that, look, your blood pressure is high or your sugar report is abnormal, and so they might advise you admission. So in the third trimester you should go prepared with these things that the doctor may find when she's examining you and she's seeing your reports. Another thing is that of preterm labor, that is, for some women, if there are some risk factors, the labor pains can start a little earlier than it is expected, because normally it is 37 weeks plus. But for some women, if there are some any infections or if there are any reasons, there could be starting. So in case you have pain abdomen, you have hardening of the uterus, then you must visit the doctor, because it might be a sign that you're going into labor earlier than normal, and she will admit you and give you some medications to control this condition. Apart from this, the important investigations that are required during this time would be, as I said, blood pressure checkup is required on every visit. Blood sugar testing is required, which is done at 28 weeks, 24 to 28 weeks. And in case if it is you have higher risk factors, some doctors may ask you to repeat that at 32 weeks. Ultrasonography usually is routinely is not done, but in case there is anything abnormal that is found in the growth of the baby, if the baby is not growing well, then in those cases another ultrasound will be required at 32 weeks. So that is how the third trimester goes. As far as the diet and all is concerned, you can take normal healthy diet, a balanced diet, everything is permissible. And because this is the time the baby has to grow, but you have to keep a check on the weight also. Nowadays there are criteria that too much or too less, both weight gains are not good. So if your weight has been a normal weight pre-pregnancy, then you should have usually an average of say 11 kgs in the whole pregnancy, out of which majorly it is in the second and the third trimester should be done. Then some of the vaccinations like the Tdap vaccine is important, which is given between 27 to 36 weeks. So that is an important part of the third trimester itself. And if you have Rh negative blood group, then in that case the anti-D injection would also be advised at 28 weeks. So these are some of the important things that take place in the third trimester. And but then if you can if there are no risk factors, if you are following well with your doctor, then it will gradually finish well in time, and you will have a normal onset of labor or delivery. So that's all, I mean, in nutshell I would like to tell you. But maybe it will be more things will be discussed if you ask on the questions that you have in your mind. Is that
Thank you
fine?
so much, ma'am.
Yeah.
Yes, they have a lot of questions. So I will just quickly jump into them.
Yeah.
Shobha has a question. Ma'am, I'm 8th month pregnant. Is it safe to travel by car?
Okay. So, see, 8 months pregnancy, traveling by car is okay. And a good care with the seat belt should be there, so that the lower part of the belt is on your thighs, and the upper one goes between the breast, so that there is a good strapping. But then very long journeys, continuous should not be there. Intermittently you should take rest and you should move around a little bit. That will be better, because pooling of the blood in the legs also, because there is edema in the legs already during pregnancy, so swelling of the feet may be there. So otherwise automobile travel can be done, but with taking intermittent breaks. In 8th month you can travel. Only thing is, the if you're going into a very high traffic zones, and risk of accidents and all, which would be there even for the non pregnant, but with pregnancy you should be more careful. So you should take travels which are necessary only.
Okay. Yes.
Yeah.
Thank you, ma'am.
Yeah.
I'll just check this second question. I'm 28 weeks pregnant. Can I drink haldi milk?
Um, I think yes, you can, and you can have, because haldi, as it is, you are taking in your food, in your vegetables, in the Indian cooking, and it has lot of benefits that are there. Yes, you can take.
Thank you, ma'am. Ma'am, Simar is experiencing backache in the 25th week. So, any specific tips for her?
Okay. Now, backache during pregnancy, 25th week is rather little earlier. It's in the second trimester only. So, one reason could be a deficiency of calcium. Second, in during pregnancy, there is laxity of ligaments. So, many women do experience some amount of, backache. It is there. So, just some local application of some ointments can be done, or some analgesic can be taken. But if it is severe, then there is a need to show to an orthopedics specialist.
Thank you, ma'am. And there are some users asking if it is to okay to sleep on the right side.
Okay. Now, see, in the normal anatomy, what do you have? You have your big vessels, that is the aorta and the inferior vena cava. If those who have, had some biology classes would remember. So they are right at the back along your spine. So therefore, we do not advise lying straight supine, and we say you lie on the sides. And left side is always, like doctors will be saying, lie on your left side, but actually left or right, if it is not straight but one of the sides, it is better, because then the pressure of the uterus on the big vessels is not there, so the blood flow continues very well. So left side usually is more comfortable, because you have the bowel and all on the right side, and therefore there might be a little problem, but either of the two, if you are doing, it is better than lying straight.
Thank you so much, ma'am. Ma'am,
Yeah.
Dipali is 29 weeks pregnant and she says she feels some pain on the right side of the stomach after urination. So, is this normal or should she get checked?
Um, mm, See, little discomfort with the increasing size of the uterus and therefore the abdomen will be there. Little stretching feeling will be there, and which is normal. But if it is particularly after passing urine, or it is during passing urine, there might be some urinary problem. So she may consult a urologist. If it is a mild pain, nothing to worry actually. It's only if it is a severe pain, or if there is some other urinary problem also, then she should consult.
Thank you, ma'am. Ma'am, Vanilla is saying I have borderline gestational diabetes and 35 weeks pregnant.
Yeah.
Baby's weight is in the 32 week scan is 2 kgs 200 grams. Is it overweight or is it good weight?
um 32 weeks, 2.2 kg. Yeah,
Yes,
just
ma'am.
after. Yeah, 32 weeks, 2.2 kg is a little overweight maybe, but not, I mean, it's in the upper of the normal, maybe you can say. So diabetes that she has is borderline, which actually we call it as impaired glucose tolerance, or maybe. So she can just have a check on her dietary advice that is there, the doctors have given. She should follow that, and repeat the scan maybe 2 3 weeks later, and they will know about it. And also continue the monitorings. I'm sure her doctor must have advised her to keep a very good daily fetal movement count, in which you count the movements of the baby 3 times a day after every meal, and there should be 3 to 4 movements in 1 hour after every meal. So if she is taking care of this, and also there is a test called the non-stress test, or the fetal heart test, maybe in normal language, simple language. So if she must, usually after 32 weeks we advise that, and we call the women. So that is, these are the things: the fetal movement count, the non-stress test, and the ultrasound after 2-3 weeks to see the weight changes. These things will guide about will tell us about the fetal well-being, and if there is any need to further blood sugar checkup is required, maybe she needs to get it done. I'm sure she must have been told every 2 weeks to get the fasting and pp done, or an hba1c done, which will tell if the sugars have been not controlled in the past.
Okay. Thank you, ma'am. Ma'am, Megha is 32 weeks pregnant. She says, I have stuffy nose. I want to know, when does the actual delivery happen, in which week? I'm really scared about COVID. I'm hearing a lot of pregnant ladies are dying while giving birth due to COVID. I want to know, does the immunity go down after birth, after delivery? So, a little bit of panic.
um, I would first say that don't panic. Panic is not going to help you or us in any ways. We are going through this COVID pandemic, which is really something nobody had ever dreamt of. Uh, but we have to face it strongly. Now, coming to the immunity question, yes, during pregnancy, the immunity is a little lower than normal. So that's the reason you have to take care of your diet, you have to take care of your exercise, you have to follow some schedules properly. The second part is that during, so obviously the risk of getting the infection in pregnant women, they have to be more careful, avoid going out of their homes, and if they go, then using the mask always. So this is all the precautions that are being told everywhere, that you use the sanitizer, you stay away from each other, and 2 meters distance. So all these things have to be taken care of so that you don't get the infection. That's one. Symptoms: the stuffy nose that she has, if there is running nose, if there is fever, if it persists, then you need to show and get yourself tested. Um, then coming to yes, so if, but then it's not that if you have covid, then delivery and all, the time of delivery and all, normally see, the normal time when the patient goes into labor is between 37th to 40 weeks, which we consider, if she goes into labor between this, is absolutely normal. So if there is, as per the guidelines that are there, if a woman has covid infection and it is below, in the early trimester, in the first and the second trimester, then we usually do not, we just manage them medically, and no effect on the pregnancy is there. Only when the covid happens in the late pregnancy, that is when she's that when it is the time to actually deliver, 37 to 40 weeks, it's only then that, and if there are indications already that she will need a cesarean only, so only those are the cases where they have to be taken up for a delivery, cesarean delivery during covid, with covid. So those are the patients who become high risk for that. And otherwise it's not that in the rest of the time, rest of the part of the gestation or the pregnancy, it is going to go off just like it is going off in 80. See, so many people are getting infected with covid, but it is majority of them are recovering with mild symptoms and with home isolation. It is some fraction of the people who have morbidities, and so they undergo, severe disease, and they have to be admitted and all. So all in all, I would say don't panic, take precautions. Best is that you do not get the covid infection in pregnancy. It is always better to stay away, stay safe from that. But if it happens, it will be managed um, well with your doctors available.
Thank you so much, ma'am. Ma'am, there's a query related to this, so I'm taking this up. Anu is saying, my husband is COVID positive. He is isolated in a different room. But is
Yeah.
there any specific care I should take for COVID? Also, should I go for vaccination? I'm 5 months pregnant.
Okay. Now, this is a very common question that people are asking, and as far as the guidelines are concerned, at present we do not have guidelines allowing vaccination to pregnant women because we do not have data on its safety and efficacy during pregnancy. So, vaccination is not yet being done for pregnant women. That's one. And precautions, so therefore what you have is again the same things: the mask, the sanitizer, the distance, and of course the husband is isolated, so she's staying away. That's a good thing. They should be and even if some communication has to be done, some help, if they are just two of them, then it should be with the mask and with precautions that they should be interacting if at all needed.
Thank you, ma'am. Ma'am, Isha has a question for you. Hi, ma'am. I'm 37 weeks pregnant. For past 20 days, I'm suffering from insomnia. I barely
Just a
sleep.
second. Anushya,
Okay,
just a second. I, the AirPods. Yeah, please continue.
okay. So Isha is saying, I'm 37 weeks pregnant. For the past 20 days, I'm suffering from insomnia. I barely sleep for 3-4 hours in the noon. Is it normal and will it harm the baby?
How many weeks you say? Please just repeat.
37.
Okay. Now, 37 weeks of pregnancy, um, sleep should be adequate. Ideally, it should be adequate. There should be at least 6 to 8 hours of sleep that she should get. It's good for the baby. I don't know if it is only now that she's anxious, there is some other problem that is happening. Otherwise, there should not be a reason that she's not getting, she's not having a good sleep. So, if it is persisting for a long time, she should meet a doctor, some medication may be given. And if there are some factors that are bothering her, there are some reasons in her personal life or regarding the pregnancy, I think they should be sorted out, because 3 to 4 hours is too less. Why shouldn't she uh, sleep? So if it is persisting for a long time, she should visit her doctor.
Thank you, ma'am. I think it's been around 20 days, so it's better that she
Yeah,
visits her doctor.
yeah, sure.
Ma'am, Priya is 29 weeks pregnant. Okay, no. Priya says, I just entered in my 8th month with twin babies. Amniotic fluid is more around one baby. What precautions should I take so that the babies will be safe? What problem can arise in this condition?
So she has a twin pregnancy, as I heard.
That's right, ma'am.
Hello. Yeah. So she's a the fluid is less around one of the babies, right?
Correct, ma'am. Correct.
Yeah. So with this condition, it happens sometimes, the growth of the two babies is, there is a discrepancy in the two babies' growth. So with the twin pregnancy, which is, there are two types of twin pregnancies. One is a dichorionic diamniotic, that is, the two twins are developing from two separate eggs. And there is another condition which is monoamniotic, that is, they are developing from one which has split into two. So in the monochorionic pregnancies, when there is a blood supply which is communicating in the two, this problem may happen, and so it is important to be kind of resolved. So the doctor will advise repeated scans, and then depending upon the time, right time, she might advise a delivery. But if these are two different, they are diamniotic, dichorionic, which is the two babies developing from two different embryos, then in that case, the one will not be affecting the other. So independently, there is a growth which is lacking. The fluid decrease in the fluid is suggestive of, sometimes associated with reduced growth also of the fetus. So that may be there, which needs to be looked up. So when she visits the doctor, she must have told some investigations also, some blood tests, and she should get them done, and based on the reports, the doctor will take decision when to deliver. And also, she should take adequate rest in the left lateral position. These women particularly need to take good rest in the left lateral position, and so that there is increased blood supply to the uterus, and which goes both to both the fetuses also. So
Thank you.
repeat scans will actually show up that whether that fluid was only in one scan or it is persisting or further reducing. Sometimes some anomalies may also be there, but then I'm sure that must have been sorted out.
Thank you so much, ma'am. I hope that answers your query, Priya. Pooja is asking, sometimes due to the movement of the baby, I feel pain in my rib cage. And also, she
Mhm.
wants to know what is breech position.
Okay, so what is her gestational age?
31 weeks, ma'am.
Okay. Uh, Feeling some pain in the ribs as the baby's size increases with the movements, this is okay, nothing to worry. And then breech presentation. Okay. See, normally how the baby lies in the uterus. You must have seen some pictures in the books or magazines. The head is below and the buttocks are above. That's how the baby lies in the uterus. So the head is below, and that is the first part that comes out. That's a normal pregnancy. But if it is the other way around, that is the head is above and the buttocks are below, this is called a breech pregnancy. So, breech pregnancy, if it is there, nowadays we do not allow normal delivery in this condition. And many times, it will be breech initially, say at 31, 32, 34 weeks. So, if at 31 weeks it is breech, she doesn't need to worry. Mostly the baby changes its position and becomes normal by the time it is time to deliver. So we assess the actual presentation at around 36, 37 weeks. If at that time also it persists to be breached, then a decision for a cesarean delivery is taken. Otherwise, most of the babies will turn to normal position by the time it is time to deliver, and there will be no problem.
Thank you so much, ma'am. Ma'am, I see here are some queries are there regarding how to prepare for normal delivery. Are there any specific foods to eat? What do you suggest so that they can have normal delivery?
Okay. The most important thing is number one, a willpower. You know, you have to be ready mentally that you want to have a normal delivery. That's one. Many times, patients over the years, we have been seeing that because they talk to their friends and families and they feel that it is very painful, why should they go for normal? And most of them just simply say, we do not want, and they just want a cesarean delivery. So, first of all, it's a good thing that people are asking this. I would say so. We would want that patients should have a normal vaginal delivery because um, though the labor pains are painful, but we have methods to reduce that pain. There is something known as the epidural analgesia, labor analgesia, that we give, giving some drug in the back of the spine. We give some injections, and with that the pain is relieved. So that is one. And then as far as preparing, there wouldn't be any particular food item that I can say will prepare you. But yes, exercises, the position in which the delivery happens, one should get used to be lying in that position. Normally, what happens that nowadays we are doing all the work, we are sedentary people, mostly sitting or standing. So squatting is absolutely not there. So because during the labor, the position has to be like that. So one has to do some exercises to learn to lie in that position so that your body is accustomed to lie in that position, and some deep breathing exercises they should do so that at that time they are able to do the same uh, in the during the labor also. So food is not there, but exercises definitely. Through this I'm not able to actually show you or this thing, but squatting positions, if you exercise in that, sitting lying down and then being in that position, and also breathing exercises. Deep breathing exercises, if you keep doing morning, evening, then it is going to increase your ability to tolerate labor pains and undergo a vaginal delivery.
Thank you very much, ma'am. I think we are actually having regular live sessions with our users every alternate day to prepare
Okay.
them with different
Yeah.
asanas. So you can
Yeah.
definitely join in, and if you do not have a complicated pregnancy, then you can join
Yes.
us in the yoga sessions. We are also
Right.
teaching them deep breathing every day right now due to
Yeah.
COVID times. So
Yeah,
I
that's
think
good.
you are moving in the right direction, right, ma'am?
Right. Absolutely. Absolutely.
So, ma'am, moving to the next question here. Hi, ma'am.
Yeah.
I've been given vaccines like Boostrix, influenza, no, Influvac, Tetra. I'm 32 weeks pregnant. Do I need any further vaccinations?
No, that's fine. During this time, this is what I was mentioning also, the Tdap vaccine or the booster. So that is fine. Because previously we used to give just the tetanus toxoid, but now we have added the diphtheria and the whooping cough vaccine with it. So she's taken, that's perfect. Only the women who are RH, who have a RH negative pregnancy, I mentioned in the beginning also, they need to get their indirect cum test done. If the husband is positive and the woman is negative, then this test is done. And if this is negative, then at 28 weeks we give an injection, which is called the anti-D injection, so which protects the baby and the mother, actually the mother, so that later pregnancies are not affected, and this fetus also is not affected because of this uh, discrepancy of the blood group. So that's the other injection which is important, and then the Tdap, nothing more during, yeah, during pregnancy.
Thank you, ma'am. Ma'am, Sakshi is saying, I just got positive with COVID, but I have no symptoms like cough, cold, and fever. Please let me know what precautions should I take as a COVID positive patient. Also, I'm very worried about my baby. Hope this will not affect my baby's growth.
How many weeks is she?
27 weeks, ma'am.
Okay, so I think that's if she has had the COVID infection but she doesn't have any symptoms, it's very good. She should still wear a mask. She should still isolate herself from the other family members. Take adequate rest. Take lots of fluids. Keep hydrating herself and take a balanced diet, her multivitamins, and the medication that has been advised by her doctor. And mostly at this gestation, the COVID symptoms, if the COVID symptoms are mild, then one does, one passes it off, the COVID infection goes off normally, and it doesn't affect the baby per se. So she will be fine. I just want to reassure her.
Mhm. Thank you, ma'am. Ma'am, here I see a query by Neha. She says, is there anything we can do to avoid early labor?
Avoid early labor.
Yeah.
Okay, so let us know what are the causes of early labor, preterm labor or early labor. Early labor usually happens in women, one who have some kind of risk factors. Risk factors like if there is incompetent os, the cervical os is short because of some uterine anomaly. For that, we usually give a stitch in the cervix. Then, if there are any infections, say in the urine infection or vaginal infection, so if there is any discharge, if there is any burning in the urine, they should immediately meet their doctor and get treated for it, because it's usually these infections which predispose a woman to early onset of labor. And then some kind of heavy exercises, some kind of over exertion, they can also lead to early onset of labor. So to prevent this, these are the things one has to take care of. Then some studies have shown that maybe too much of spicy food, too much of, you know uh, they may sometimes, if it is taken very frequently, then that may also lead to this thing. And if they have some leaking, that is bursting of the water bag, then of course she is liable, but you cannot do much about it. So, as far as how one can protect herself is by, avoiding very strenuous exercises, by taking a normal balanced diet, by getting early treatment if there is any vaginal or urinary infection. These are the things by which you can protect yourself. Other risk factors, the doctors will take care.
Thank you, ma'am. Ma'am, is it safe to take paracetamol or crocin during pregnancy if they have fever?
Yeah, absolutely. Paracetamol is the safest drug which can be taken in pregnancy for fever, even for analgesia. If you have pain, then also you can take a paracetamol. So it is safe during pregnancy.
Thank you, ma'am. Ma'am, Rashmi is in the 34th week of pregnancy. So, in the 30th week scan, baby's head was down. Is it possible that baby can change this position? How can I know if my baby's head is down or not?
Yes, so baby keeps changing. It's surrounded by a water bag. So it is kind of floating, and especially if the amount of fluid is more. So these changes keep happening. You need not be, as a patient, you should not be worried about what is the position before it is time to delivery. As I said before, also that it keeps changing. So it's okay. 31 weeks, 32, 34 weeks, it's okay if it is the head is down or it is up. But usually by the end of the pregnancy, it will come back in its normal position. And you can't do anything about changing the positions of the baby or knowing what it is.
Thank you, ma'am. Ma'am, Swati is saying, I have more baby movements since last 2 days. What can the reason be? I'm 29 weeks pregnant.
29 weeks pregnancy, nothing to worry. Increased movements, I don't think there is any. Maybe she has started perceiving it better than before now, because now the size has become, optimum to have good fetal movements. So I don't think there is anything to worry about. Baby may be a little more active now.
Thank you, ma'am. Just into the questions. Okay, one question here is, some people say that if I crave for something and don't eat that during pregnancy, after delivery we won't get breast milk or something will happen to the baby. Is this a myth or is it true?
Yeah, it is a myth only. It's a myth only. The cravings, if they are for food items, healthy food items, it's good. You should go ahead and have as much as you wish. But if it is for certain things, like, some women have for clay or any abnormal things, then of course you have to stay away from it. Try to stay away from it. So it is absolutely a myth that if you don't have, you will not have. Breast milk will be good if the woman is well fed, is having, adequate amount of carbohydrate and protein in her diet. She will have good milk output. It is not related to your cravings.
Thank you, ma'am. Ma'am, Jyoti is 29 weeks pregnant. She says, I'm getting white discharge every day. Is this abnormal?
Okay, 29 weeks, white discharge. Now, see, there is some normal vaginal discharge that happens, which is, a sticky white mucus that may be there. So, or a little bit of vaginal discharge only, which is normal. But if there is excessive discharge, which is associated with itching or foul smell, or, it's kind of flowing, then definitely you need to show to your doctor. It is a sign of infection. So a foul smelling discharge, may, itching associated with it, or profuse discharge, purulent discharge, these are abnormal. You must visit and get yourself examined. Some tests will be done. Maybe that fluid is sent for culture and all, and some medication will be given, maybe oral or something to put from down below. So if it is that type, you must go and visit.
Thank you so much, ma'am. Ma'am, Sonam is saying, I'm 25 weeks pregnant. I have not taken the second dose of tetanus injection till now. Till how many weeks can I take it?
She should take it. Usually, the first dose and the second dose interval is 4 to 6 weeks. That's the normal. So if she has delayed, she should take it now, or she can go directly for the Tdap vaccination during the third trimester. So that she can do, or that will cover that also.
Thank you, ma'am. Ma'am, Akshita is saying, my placenta is lower side with 3 centimeter and I have done OS tightening. Is it good to practice yoga at home?
Um, you said she has got os tightening. That's
Yes,
so,
yes,
and her placenta is low.
yes, low 3 centimeter.
You know, uh, okay, let me cover these two aspects. They are two things together. So, having the placenta lower down, this is called placenta previa, or a condition in which there is a risk that the woman will have some bleeding episodes during pregnancy, and that may lead to, heavy bleeding, or she may need admission, and we need to manage that in one, with all the protocols that are there. So that is one. So here one needs to take care that she doesn't have, overexertion, and does not have to go for uh, activity. Um, right. So that is one. And the os tightening that she says, I believe that is the stitch in the cervix, at, which I was mentioning before when you asked the question about someone who said that how to prevent early labor. So in that, I said that if you have a short cervix or your os is open, then they put in a stitch. So what os tightening she's saying is probably that. So if she has had a stitch there, then she needs to take care, because she stands a high risk of, she has two high risk factors. One, to go into early labor because of the os, and second, due to the placenta that is coming down. So she needs to be careful about both the things. And could you just repeat? She asked something specific that
Yes, she wants to know if it is okay to practice yoga at home. So
yoga.
probably not,
Okay.
right?
Yeah, it's not a very, because we don't know how much exertion, what kind of this thing she will do. So better to, with so much, so two of the risk factors, it's better to avoid.
Thank you, ma'am. Ma'am, Supriya is 25 weeks pregnant, and 3 weeks ago she found out that she is borderline gestational diabetic. I am monitoring my sugar levels at home. On an average, sugar levels are 80s before breakfast, and after food it is 90 to 115. My endocrinologist suggested to have metformin 500 mg thrice. Please suggest.
Uh, you know, uh, 25 weeks only, and 3 weeks back she was diagnosed to have uh, diabetes, gestational diabetes. Now the sugar values that she is telling is 80 before, and after the meal we do it after 2 hours. And if it is 90 to 115, like normally we just want it to remain below 120, but probably in her case it is a little really lower. So with this kind of this thing already there, I don't think there is a need to add metformin. She should reconsult, because the sugars are absolutely normal, rather a little on the lower side. So if you add metformin at this time, it will be may go further lower, which we do not want. So right, with the the record of the blood sugar, she should reconsult, because adding metformin on these values would lower the sugars further, which is not very good.
Thank you, ma'am. Ma'am, there are a few queries asking if it is safe to eat mango and watermelon during pregnancy.
Absolutely fine. Please go ahead. Until unless you are a diabetic, And so the sweet fruits you will have to take, there will be limitations for that. But otherwise, yes, you can go ahead and take these fruits.
Thank you, ma'am. Ma'am, Deepthi is 35 weeks pregnant, and from yesterday, she's having continuous stomach. No, she's having stomach pain, but not continuously. Sometimes it pains. So, does she need to check with the doctor?
35 weeks, having pain abdomen, not continuous but intermittently. And if she has to see if it is associated with the hardening of the uterus, then she must go to the hospital. If there is no hardening, it's just a pain, and maybe if it is she has had some overeating, or it is just some kind of related with the meals, then maybe some simple it may be gastritis or something. Then also she needs to take some antacid. So we have to just ask some more details, that whether it is associated with hardening of the uterus, or it is associated with meals, or it is relieved with taking the antacids or not.
Thank you, ma'am. Ma'am, Tanvi says she's 32 weeks pregnant, but the doctor has not asked her to put the Tdap vaccine yet. So,
Uh-huh.
should she request her doctor?
Yeah, she can talk to her doctor. She can talk to her doctor, and because these vaccines have come uh, recently. Recently means in the last few years only. And let me tell you, these are vaccines which are one has to buy. They are not in the government programs as yet as free vaccines. Okay, so in the government hospitals, they are not being provided as a routine like the tetanus toxoid is being given. So only patients who can buy it, we will be prescribing in the government settings. But those who are going to the private sector, definitely most of them are being prescribed and they are taking it. So whenever these newer things get added up and there is some cost factor related, so these differences will be there, that not every doctor will prescribe. So it's fine if she knows about it. She should go and request her doctor to prescribe and she can take it.
Thank you, ma'am. Ma'am, I see a relevant question here, so I'll just take this up. Nidhi is 8 weeks pregnant. I already took first dose of Covishield before pregnancy and had COVID in August 2020. Should I take the second dose now or should I wait?
Uh, okay. So she's 8 weeks pregnant, and before that, she got the vaccine. So I don't think she should take the second vaccine now, and she should wait, because we do not have recommendation for COVID for the vaccine during pregnancy. Moreover, so that the one that she took was an, we can say, an accidental one in the beginning only. But and as it is, she has had COVID in the last year, so most probably there would be antibodies. So I would not recommend taking the second dose now.
Thank you, ma'am. Ma'am, Vaishnavi is 20 weeks pregnant and she had a C section previously because she did not experience for contractions till 42 weeks. So
Yeah.
she's saying, is there any specific care that I can take to have natural contractions this time?
So, see, actually, when one doesn't have normal pains, even by 40 weeks of pregnancy, we evaluate the patient. If everything is normal and she's suitable for vaginal delivery, then there are methods to start the labor pains. There are some medications, we have, so there are some gels, so which can be put from the cervix, and there are some medications, as I said, which can be taken orally or from below also, and some injections also that we can use to induce labor. This is called labor induction. And so that trial should be given if the patient is willing. And I don't know if that was given or not in the last time, but she had a cesarean. Now, this time, uh, I cannot advise something which will start the onset of labor, but yes, having just one cesarean doesn't mean that the next time also it will be a cesarean. It will depend upon whether what was the indication. Like in this case, it was only because pains did not happen. So that is not something which, because of which we should repeat a cesarean. So I personally feel she can go ahead for a normal labor this time, and if she doesn't have pains again till the last date also, she should request her doctor to try the induction of labor or reach to someone who can give her that facility.
Thank you so much, ma'am. Ma'am, Priyanka has a question for you. She's 32 weeks pregnant and she has a single right kidney. Shall I try for normal delivery or there will be complications due to this?
Single kidney, uh, she must have donated or something. Anyways, if she is donated, she's on some medications, she has some other high risk factors, then because of them, maybe somebody would advise cesarean. But if it is congenital and she has been managing absolutely normally with that, then in that case, I do not think this alone would be a reason to not allow a vaginal delivery. So actually, a lot of other things will have to be evaluated. If we do not find any other reason, then this alone will not be a reason not to allow her vaginal delivery.
Thank you, ma'am. Ma'am, Sugandha has a question for you. Hi, ma'am. I'm 34 weeks pregnant. In my last scan, which was done on 24th of April, the umbilical artery shows high resistance waveform with reduced diastolic flow. The SD ratio is 4.1. Baby weight is 2261 grams, plus minus 348 gms. My EDD by CGA is June 4th. But my doctor recommended that delivery needs to be done early with induced labor. I want to know what are the chances of delivery and what can I do to improvise the flow.
Uh, actually, Sugandha, you cannot do much to improve the flow. You know, these are some uh, disturbances in the placenta that happen because of which the blood flow reduces, and there is this high resistance flow that is there. You are seeing the SD ratio which is increased. So these things indicate that the blood flow is reduced, you know, is not optimum, and so it affects the growth of the baby also. And that is the reason that the doctor has said that there might be a need to deliver the baby earlier than the uh, term pregnancy, or 37 weeks maybe. So we usually, when we follow such patients with a Doppler studies, this is a Doppler study, so we follow till the the blood flow is there is no reversal of blood flow and the end diastolic flow is there. Uh, so we, and then we plan a delivery. A lot of other things are also seen, the amount of fluid that is there around the baby, and then we decide whether it will be a vaginal delivery by induction of labor or it will be cesarean delivery. So an overall assessment is done in such pregnancies to take a decision. But yes, she's right that the delivery might have to be done earlier than your 37 weeks of pregnancy also. It will just depend. She will most probably follow up with another Doppler study at an interval of 7 to 10 days and then take a decision. Although your weight, the fetal weight that I heard, 2261, something like that, it is not a bad weight. And this weight babies will usually survive. Of course, the plus minus you should remember. So when we say that it may be plus minus 200 grams, 2 to 300 grams. So I think everything will be all right um, by an earlier delivery, because the delivery is done. It simply, these features suggest that the baby is not doing so well, so great inside, and therefore we might have to take the baby out, right?
Yes. Thank you so much, ma'am. Ma'am, Jyotsna is saying, I have COVID and my temperature ranges from 99 to 101 ever since I got down with it. Baby movements has reduced considerably. Is it expected that when the mother is unwell or should I get a checkup done?
She's COVID pregnancy. How many weeks? You didn't tell me.
25 weeks pregnant.
25 weeks pregnant, and she's running temperature and the baby movement she is not feeling. See, 25 weeks is too early. Some not all women feel the fetal movements very well, but she must visit a doctor and get the medications and be under supervision. But nowadays, whatever we are going through, whatever we are learning through the pandemic, a 24 weeks pregnancy, we will be always more worried about the mother. We would like to give the best care to the mother, um, and keeping the baby as a secondary thing, because as it is, the baby is too small to survive at this time. So, but if everything goes fine, maybe this COVID just passes off with mild symptoms only, and both the mother and the baby are fine. But she must visit and get the treatment prescriptions.
Thank you, ma'am. Ma'am, Chaitanya says, I'm in the 19th week, done anomaly scan. In that, radiology said single umbilical artery found. Also suggested to do 2D scan after 24 weeks. I want to know whether it has any serious problems or how can it be handled.
Um, she's 19 weeks. Now, this is a finding on the scan that the single umbilical artery, and if it is isolated, not associated with any other anomalies, then it sometimes may be associated with some genetic syndrome or something. That's why they have asked for a scan at 24 weeks to look for any other anomalies that are present, and then take a decision and then be able to counsel. So it is an abnormal finding, but if it is isolated or it is associated with other things, needs to be known, which will be confirmed after that. So yes, it has to go like this.
Thank you, ma'am. Ma'am, Jisha says sleeping on the sides gives me pain in the joint of the leg.
Sleeping on the side gives her pain in the joints of the legs.
Yes, ma'am.
Is it?
Hip
Um,
hip joints.
hip. Okay. Okay. Hip joints, because there must be pressure on that. So she can keep changing her position, and if the pain is only at the time of lying down and not otherwise, then she should change the position. But if it is otherwise also, then uh, she should meet her doctor, because maybe there is some other problem with the bones and the ligaments. Although, as I said before, some aches and all do happen because of the laxity of the ligaments, and this may be most probably postural, so she can change to the other side. Um, and if it is on both the sides, and if it is severe, then she has to see a doctor.
Thank you, ma'am. Ma'am, Sai Lakshmi is asking, I'm in the 34th week. In my growth scan, I can see the placenta anterior 1 and 2 maturity. Lower margin is at a distance of 3.5 centimeter from internal OS. Is there anything to worry about? Are there any possibilities of normal delivery?
No, I think 3.5 centimeter away from the os is okay, and most probably she should be, a vaginal delivery should be possible in this case, but it will show up later only at the time of labor if there is no bleeding. If these findings are absolutely correct and they remain so, uh, it should be all right. Nothing to worry. Because,
Thank you.
yeah,
Yes.
yeah, I was just adding, actually, nowadays the definitions of placenta previa have changed. So previously we used to say 5 centimeters, and then now, so that's why, this reassurance that I was trying to give, that if it is accurately this finding, then hopefully she should have be able to have a normal delivery also.
Thank you so much, ma'am, for patiently answering all the queries. I think we've run out of time now, and there are a lot of questions pouring in for you. But we'll have to close it here, everyone. So, if we've missed your question by any chance, then please post it in the feed section. One of our experts will revert to you within 24 hours. And, ma'am, thank you so much for making time for us and doing this session and helping all of them. They are very, very thankful to you. And
Thank you, Anushree.
thank you, ma'am. And to all the users, do practice yoga, do practice pranayama, do join us for the breathing session at 7:30, where an expert will help you just relieve your stress every day. So we will see you at 7:30, and doctor, we'll see you again for another great session.
Okay. Thank you all. Goodbye. Thanks for giving me this opportunity for interacting with you. Thank you.